Hi everyone, I'm Dr. Niharika Aneja. I head the Department of Emergency in Manipal Hospital, Sarjapur Road, Bangalore. Today we would talk about a very important topic, Heimlich Maneuver. Heimlich Maneuver is when you see a person choking, then you go behind them, put your arms around their lower chest and where the abdomen starts. It's at that level. You'll make fist from one of your hands and encircle the other hand on top of that hand and try to give upwards and backwards thrusts. So this would increase the pressure inside their chest and eventually bring the foreign object out. Is when you see a patient cannot speak while he's choking or drooling saliva or has turned blue. They might have a universal sign of choking on them, that is basically holding both their hands on their necks and showing that they are choking. Heimlich maneuver should not be performed on somebody who's able to speak, tell that they are choking, or are able to cough out the foreign object. So there are some modifications when it comes to children and infants. If a child is as the same size of an adult, you would continue the same Heimlich maneuver as we have described before. If the child is shorter in height, then you would kneel down behind the child and do the same process again. If the child is less than 1 year, then you would sit with the child on a chair comfortably, putting the child downwards, and you would give something called back slaps, which are 5 in number. Back slaps are given in between two shoulder blades where our spine is, with the help of the heel of your palm. You give 5 back slaps and then you turn the baby up and you give 5 chest thrusts through 2 of your fingers at the lower part of the breastbone. You give 5 of them and then again repeat with 5 back slaps. You continue doing this, but every time you would inspect their mouth for a foreign body. If you can see the foreign body clearly, then you would sweep it out. But you would not attempt a blind sweep if you can see half of the foreign body. This is important because you can push the foreign body more inside and it can go to their airways and block complete air, and the patient might get a cardiac arrest. You would repeat these back slaps and chest thrusts till the foreign body is out or till the child loses consciousness. If the child loses consciousness, you would keep the child on a firm flat surface and start with your CPR. In children, if you have 2 people to help, usually you give 15 chest compressions as we taught you the chest thrust with 2 breaths. So you do this 10 times because you have to maintain a count of 100 to 150 beats per minute and give as many breaths as possible. Because here our culprit is the foreign body, which is sitting in the airway and cutting the oxygen off to the brain of the child, and that's why the child lost the consciousness.